I'm Nima Rajan, and this is Forum Daily Week in Review. This is day one on the job for one of the youngest and first Indigenous president of the Canadian Medical Association. Dr. Alika Lafontaine says Canada's healthcare system is in crisis and that he wants to advocate for a national standard for medicine that will be consistent across all regions. Dr. Lafontaine also wants to advocate for marginalized voices in healthcare and plans to draw on his Indigenous identity while working on solutions to a range of problems. Well, this comes as Canada's healthcare system continues to deal with staffing shortages, long wait times, and growing mental health concerns among medical professionals. Well, joining us now to tell us how he plans to tackle a system in crisis is Dr. Alika Lafontaine himself. Sir, welcome to Forum Daily.
Thanks for having me.
Now, I know adding a voice to marginalized communities is a priority of yours. So, as the first Indigenous president of the CMA, how do you plan to draw on your heritage as well as your lived experience as a physician in Alberta to help address the barriers that Indigenous communities and other marginalized communities continue to face in healthcare?
Anytime that you have a new voice around a table that hasn't been there before, there's an opportunity to really learn from their lived experience. We're in the midst of crisis in the mainstream healthcare system, but there's a long history of dealing with crisis in Indigenous communities across the country. And so we can bring in those learnings, we can take the principles that we know work from those decades of experience, focusing on the people who actually are affected, making sure that the people actually provide the care, provided the support, and making sure that we track where our resources go so we can make sure that the things that we think we're solving, we're actually solving in the course of trying to change healthcare.
And we know you're advocating for a national standard for medicine in Canada. So what would that standard look like across the country?
So I think the word standard encompasses a lot of different approaches. So each of the provinces has their own approach to registration for health professionals. Each province has their own approach to the different rules that govern practice. They all have their different approaches to health and human resource management and the way that they define primary care within each province. And so, depending on whether you live in Quebec or whether you live in British Columbia, those can look very, very different across the country. I think what we've learned in this pandemic is that there are certain things that make sense when you decentralize, and there's other things that make a whole lot of sense to centralize. And going through the discussion of finding out which things we can adopt across the country so we truly do become a Canadian healthcare system instead of siloed territorial and provincial health systems is something that's well worth discussing and that could lead to a lot of solutions to the problems that we face.
And turning to some of the key issues facing healthcare right now, staffing shortages are continuing to affect Canada's healthcare system. So, what steps are you pushing for officials to take to help grow Canada's medical teams, bring in more doctors, and keep the ones that are already there?
So there are immediate things that could be done. The first focus of any government should really be ensuring retention of the people who work right now. And that can come in the form of different incentives. Some of those are related to money, other things are related to working conditions. But the second big part is making sure to have space to actually provide that high quality care that we all wanted to provide when we first came into medicine. One of the most satisfying parts of being an anesthesiologist, which is my own specialty, is connecting with patients and having them have a good experience from the very beginning of when they meet me to the end. And right now in the healthcare system, there's not a lot of space for that because we're so focused on doing things at the lowest cost at the highest volume. The third part is finally actually getting to that team-based care that we talk about. Every time that we talk about team-based care, it seems in recent news, we talk about replacement of one type of provider for another. For example, there's not enough family physicians, so who can replace family physicians? When in reality, if we drop the barriers of people mobilizing across the country to different parts, if we drop the barriers and create national approaches to things like virtual care, we can all lift where we stand and provide an environment for patients to get the best care where we all do what we do well.
All right, doctor, just about a minute left here. But after speaking to a lot of physicians and medical professionals on the show, we find that mental health is a huge concern within that environment. So how should officials address the issue of mental health among medical professionals as well?
Well, we definitely know that mental health has gotten worse for providers across the country in the past few years. Many people are deciding to leave practice or scale back the amount of time that they spend in healthcare. If there is one thing that we can get across is that mental health issues are a result of poor working environments. The stresses that you experience, you never recover when you go home and then come back to work again. We have a lot of health professionals who can't actually remember, an easy day at work. Every time you come in, you catastrophize another horrible thing that can happen. And I imagine for patients, having providers constantly on edge, worried about what might happen to their patients, doesn't lead to a good patient experience. So really doubling down on creating that space to provide an excellent patient experience and providing good working environments. I think that's the best way to address mental health in the health system right now.
All right, lots to keep our eyes out for at the CMA. Doctor, again, thank you for joining us today on Forum Daily.
Thanks for having me.
Authorities in Jerusalem, New York, and London say polio is spreading in those cities, and the origin is the oral vaccine used to wipe out the disease. Now, in what is an extremely rare phenomenon, recently discovered polioviruses in the cities are mutated versions of the weakened form of the live virus that was used in the vaccine. The latest incidents represent the first time in several years that the vaccine-connected poliovirus has turned up in rich countries. Since 2017, there have been 2,600 cases of the vaccine-derived poliovirus linked to the oral vaccine, compared to 396 cases connected to the wild virus, according to the WHO, which brings up concerns around a resurgence of the potentially fatal disease. Well, joining us now to talk more on this is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here.
So how is this possible, Dr. Raut? How can a vaccine create the very virus that it's designed to prevent?
Right, how indeed. So we should talk about the oral polio vaccine as opposed to the injectable one here. The oral polio vaccine was used in the 1980s. It was very cheap and easy to administer, 2 drops directly into the patient's mouth. It was really much better at protecting entire populations when polio was spreading. And of course, it contains a weakened form of the live virus. Now, what we've noticed is that typically these outbreaks from this vaccine occur when people who are vaccinated will shed the virus in their feces, and from there, that virus can spread to the community, mostly to unvaccinated individuals, and over time, create a form that can cause new epidemics. In Canada alone, we used to use the OPV, or the oral polio vaccine, quite heavily in the 1950s, and we replaced everything with the inactivated poliovirus injectable vaccine around 1995.
And this is the first time in years that the vaccine-derived poliovirus has turned up in rich countries, Dr. Raut. So what could have caused its resurgence in such countries?
Right. So infectious disease experts, public health experts, physicians, we're not surprised to see it reappear in countries such as the United States, Canada, and the UK. We've seen over the past few decades, protection from disease, public health, education programs have been undermined by funding cuts, vaccine hesitancy, forgetfulness, and of course the nature of the virus itself, which mutates and multiplies. So I think this is very much a wake-up call for all of us and our officials that infectious disease are present and are here to stay. So until we have these diseases fully eradicated, we are at risk.
All right, so let's compare these two types of vaccines, Dr. Raut. I'm sure our viewers are very interested to know how likely oral vaccines are to produce these mutated viruses compared to injectable vaccines.
Right. So let's start with the injectable one first. As far as injectable vaccines go, we really expect none to create this mutated version of the vaccine because there is no live virus present in the injectable form. For the oral vaccine, we know it can cause polio in about 2 to 4 children per 2 million doses, literally a 1 in a million chance. And in extremely rare cases, we see that weakened virus can mutate into a more dangerous form and spark those outbreaks.
All right. Well, in terms of this mutated poliovirus, how does it compare to the original or wild version of the poliovirus?
Right. I think the big difference we're seeing at this point is number of cases. So since 2017, as you mentioned, there have been about 396 cases of polio caused by the wild virus versus when we look at 2,600 linked to the oral vaccine, which means currently more people are getting polio from the mutated virus than the actual wild type virus.
So should Canadians be concerned about a potential resurgence of polio in this country, Dr. Raut?
Right, so a vast majority of Canadians have been vaccinated against polio already, and we know that unvaccinated Canadians are the risk here. So the latest data does show 90% of toddlers have had all 3 doses. The concern that we have is at-risk communities, so communities which have lower than 80%, lower than 90%, which we can find in several areas across the country. Those are the ones that are particularly at risk for getting polio.
All right, Dr. Rowd, a quick 30 seconds left here, but what sort of message do you have for our viewers amid a world of monkeypox, COVID-19, and now this mutated poliovirus?
I think the important thing here is all of these are just a good reminder to really stay up to date with the vaccinations, even for the rare vaccine-preventable diseases. Really, as Canadians, we have to make sure we and our children are properly immunized against COVID-19, polio, including all of their boosters, and just keeping those immunization cards fresh and updated.
Always an informative conversation, Dr. Rowd. Thank you again for your time today.
Thanks so much.
All right, we'll be back after the break with a look at inflation's impact on Canada's seniors. Our interview with Diana Cable from CanAge about how older Canadians are being impacted on many levels by these rising costs is up next. Stay with us. Experts are saying that sky-high inflation is putting Canadian seniors at increased risk of social isolation. Many older adults live on fixed pensions or government benefits that aren't keeping pace with the rate of inflation in 2022. Now, this means that many are being forced to cut back on gasoline, transit fares, and entertainment costs, like eating out or taking classes. Seniors who can't afford internet or a cell phone are also less able to stay in touch with family and friends. Loneliness and social isolation in older adults has been linked to depression, an increased number of falls and use of health services, and even premature death. Well, with us now to discuss the issue is Ms. Diana Cable, the Director of Policy and Research at CanAge, Canada's national seniors advocacy organization. Ma'am, welcome to Forum Daily.
Thank you very much for having me.
So we mentioned government benefits or fixed pensions aren't really keeping pace with inflation. But what about the investment portfolios of seniors, including real estate equity, which I'm sure a lot of seniors were relying on? How is inflation impacting these long-term investments and financial security of seniors?
So for those who depend on who are using their homes as equity and are planning on using that into their retirement, either through a reverse mortgage or some other kind of funding, they're now taking a reduced cut, meaning there isn't enough money in order for them to do all the things that they had planned to do in their retirement.
And amid all of this, what have you been hearing from seniors in terms of their quality of life following the impacts of inflation?
Well, you mentioned one of the big ones, and that's depression. It's easy to fall into depression if you're always concerned about whether you have enough money to be able to buy nutritious food or to pay for your rent or your medications. These aren't things that we should have to be worrying about.
And all of this cutting back, as we mentioned, is contributing to social isolation and the connectedness with family and friends. So in what ways does this in particular affect the overall mental and physical health of seniors in Canada?
Well, there was a study a few years ago that came out that said that social isolation can impact your health, mental and physical health, as much as smoking 15 cigarettes a day or an overuse of alcohol. Think about that. That's very dramatic. So if you're not leaving your building, if you're not even going out to buy groceries as often because you don't have enough money, if you're not going out to visit your friends, if you can't pay for your internet, as you mentioned, so you can't afford to do FaceTime with your children or your grandchildren or friends, even gaming online has become popular. Words with friends, for example, Scrabble with friends. When these things get cut out, you are isolated and sitting in your apartment or your home by yourself.
Some very surprising information there, Ms. Cable. So just how many seniors in Canada are being impacted by this right now?
Well, we don't know 100%, but what we do know is that almost 28% of seniors live on their own in Canada. That's a quarter of our population, or over a quarter of the senior population. So at a minimum, it's affecting, I would hazard a guess, a quarter of the seniors population.
All right, ma'am, let's talk about solutions. What kind of steps can our officials take to better address the needs of seniors amid record inflation?
Well, that's a tough question because they are balancing what they can do for the entire country and helping us get through these tough times of high inflation. But I think that, and there are so many factors involved, but I think that one of the things that the government can do is that they can be listening actively to their constituents to ensure that people's core needs are being met, especially food security, housing, and healthcare, particularly when a time like this, when many older Canadians and frankly other Canadians are really, really feeling the pinch. So they need to be able to listen and respond so that people aren't making difficult choices such as choosing food or medication.
And bringing this back to our viewers at home, what are some ways that individual viewers can get involved, especially with their senior loved ones?
So, with your senior loved ones, make sure you're reaching out more regularly than you may have been doing in the past. Even a short phone call once or twice a week goes a really long way. It doesn't even have to be a check in phone call. It can, just be, hey, what are you having for dinner tonight? I'm thinking about making this. Remember that recipe you made one time? It can be really casual. Also, if you have older Canadians living in your neighborhood, reach out to them, knock on their door, invite them out for coffee. Front porch coffees are a great thing, and we still have warm enough weather that we can do that. Another thing that can happen within the community is there are lots of free programs. For example, somebody wrote into us and said that they had joined a walking club that their local library was coordinating, and that's a free activity, and it got them out and they were loving it.
Stay with us. We'll be right back after the break. The eligibility for medically assisted death in Canada is set to expand to include mental illness in 2023, sparking debate among advocates on whether this law is going too far. Currently, Canada's euthanasia laws are set to be some of the most permissive in the world, with over 10,000 medically assisted deaths in 2021 alone. However, human rights experts point to concerns around Canada's current MAID regulations and potential abuse of the system. Recently, a Canadian veteran suffering from PTSD and a traumatic brain injury was casually offered euthanasia from Veterans Affairs Canada when he was just asking for help. The Canadian government is opening an investigation into this case. However, advocates say it's not unique in Canada. Questions remain around whether safeguards and proper regulation are in place to prevent further abuse of the system as MAID expands in March. Well, joining us now to discuss the issue of mental health in Canada and her perspective on the issue is Ms. Margaret Eaton, National CEO of the Canadian Mental Health Association. Ms. Eaton, welcome back to Forum Daily.
Thank you so much. Glad to be here.
Now, we know the CMHA has been advocating for a national mental health care program in Canada. So what are your thoughts on expanding MAID to include mental illness in March 2023 prior to a national program like that?
Well, first, I was so sorry to hear about the experience of that veteran. And that is exactly what disability advocates have been concerned about, that MAID would be used in situations where it wasn't appropriate. So the CMHA published a position paper back in 2017 stating that we did not believe that mental illness by itself was an adequate qualification for MAID. We believe that recovery is possible. And really, until everyone has access to appropriate mental health care, we should be really working on providing that support so that everybody has the opportunity to make a full recovery.
So what do we know so far about the connection between suicidal thoughts and mental health, and more importantly, the impact of mental health treatment on such thoughts?
Well, last year, about 10% of Canadians said that they had suicidal thoughts over that last year. And that is a big increase since COVID. Prior to COVID, only about 2.5% of Canadians would have said that they had suicidal thoughts. And it's particularly people who have anxiety and depression or a history of mental illness who have experienced those suicidal thoughts. But that risk of suicide can be prevented by providing access to things like psychotherapy, mental illness prevention and promotion, or peer support, but also providing social supports like making sure everyone has good social connections, that everyone has reliable housing, food, and income security. And there's really interesting new research on pharmacology that suggests that new treatments are being developed even as we speak. So there are ways to help people overcome suicidal thoughts and that risk of suicide.
And I guess the big question here would be whether there are any mental health illnesses that constitute treatment through medically assisted death in Canada. What are your thoughts, ma'am?
Well, we don't really believe MAID is a treatment. As I said, we believe recovery is absolutely possible. I know there are some intractable mental illnesses, such as treatment-resistant depression, and those things are a real puzzle for the medical community, and they could become unbearable to an individual. But that said, as I mentioned, we believe recovery is available and that new treatments are being developed all the time. So the focus really needs to be on comprehensive, free, and quality mental health supports in all communities across the country.
So what steps can our officials take to prevent abuse of the system when mental health does become, or mental illness rather, does become part of MAID requirements?
Well, we know that MAID has a rigorous process already of checks and balances, and there was a recent report that was prepared where an expert panel was brought on to say what sort of safeguards are needed so that we can actually ensure that the kinds of things that veteran experienced aren't going on. So this expert panel included representatives from CMHA, and it recommended things like practice standards, so advice to doctors about what kinds of questions they need to be asking to ensure someone meets the criteria. There needed to be better interpretation of what is an irremediable medical condition. And there has to be a robust assessment process. So there are many things that can be done to make sure that people are accessing it appropriately.
All right, Ms. Eaton, a quick 20 seconds left here, but what are you keeping your eyes on as this law is set to expand next spring?
Well, we're really hoping that the federal government will consider expanding access to mental health care in conjunction with this legislation. So we believe in universal mental health care, and we're going to be developing a campaign this fall where we will lay out exactly what that might mean for Canadians, and hopefully that will reduce the incidence of suicidality.
All right, I'm Nima Rajan, and that'll do it for your look at this week's important conversations. Thanks again for joining us today on Forum Daily's Week in Review. Take care, Canada.